As I told yesterday, no one of us was born in London. Feel free.
It is
Yes.
true.
Hello,
Ira, nice to meet
Irina.
you. Ira.
This is doctor from Norway, Irina.
Yes.
Norway. Oh,
Yes.
nice
Very
to meet
nice
you.
to meet you too.
Still very cold in Norway.
No, it's very nice day actually, and sun is shining. Everything is nice.
Oh.
28, если что. Я сама проспала, я вообще в таком этом.
But you are from Beijing, right?
Actually, I'm from Taiwan, but I live in Beijing for 6 years.
Yes, it's very nice.
Yeah.
Mhm.
Yeah. Since after I start to develop this PLLA regimen, I must contact with a bigger market.
Okay. Yeah.
Excuse me for a second.
Там, если что, в истории будет делать прям прямой эфир, ты посмотри, чтобы там, знаешь, лысины не было. Этих, вот это все тоже поубирать, потому что тоже...
In Norway, is there many doctors using this PLLA?
Mostly in the threads, not injectable, but threads, PLA or
Thread.
and a combination. We are using this. Yeah.
Okay. PLLA thread is the silhouette thread.
Yes, threads. It's called, and yeah. Mhm.
Oh, okay.
Made
I
by.
also use.
Mhm.
So it's a larger ball thread.
Yes.
Larger one.
Yeah.
Okay. I use a very tiny, just like hair, PLLA thread. Yeah. Maybe next time I can show you how this work. It doesn't depend on mechanical traction. It's physiological, neurological, and physiological traction. That is the topic that I gave last year in France for IMCAS. It's a different concept.
Zufra,
It's very interesting for us as well. I suppose that we will collaborate for a long time, Dr. Cheng. We need to change our knowledge and experience. And it will be our pleasure to know from you, you know, some news, some new technology. We will be with pleasure continue, you know, our collaboration. Yeah.
Yes, we have many things developing, including maybe we will use PLLA for breast processes, but it's different from a single processes. Maybe we can inject maybe thousands of tiny processes, so the shape change will be better, and the texture will be better than a single bag, water bag or silicone gel bag. It's too heavy, and we just changed one single large processes into thousands of tiny processes, and you don't have to surgery to put it in. You just inject them.
Yeah.
And I can I open the thread inside? This is
wanted to show us the thread as well, yeah?
Thread. Yes.
Wow. It's
smaller than my hair. I had people open the stocks. This is the sample we have. But actually, I used that kind of method for over 8 years. And I think the most distinguished character of this PLLA thread and threading and the injection is you can repeat it unlimited times in a patient's lifetime. So far, my patient's record for PLLA injection is 39 times. And this threading is 17 times. So we can we can repeat and repeat in the same patient as long as they are affordable, as long as they have the money. They just keep doing that.
Of course, the patient have money is interesting.
It seems that only my video is. Oh, okay, that's better.
Can we start our presentation?
Yeah.
Yeah. So, my dear friends, I'm so happy to see you in this morning in Prague, in your countries. Maybe they already in Beijing already half of day. So I am very pleased to introduce Dr. Cheng with a presentation of polylactic acid products, company of Trueself. My dear friends, I already test and try these products. It's fantastic. And as I understand, so many questions about polylactic acids. And we asked Dr. Cheng to explain us how it works, what is the mechanism, what result we can expect, and etc., etc., etc. So, Dr. Cheng, please start your presentation.
Okay, thank you, Dr. Tupa. It's my pleasure to meet you on air, okay? And I believe all you have a very good day. Today is the first time that we meet, and maybe if there is so many chance that we can keep this topic, I think I will separate our content to a series of lecture, because there is so many content that we can keep talking, maybe at least 5 days or 7 days. So today, I think the PPT is moving by Iju or by me. I think we can move in our PPT for the next one. Aju, did you there?
Yeah. We see it.
Okay,
Yeah, we see your presentation.
Okay. The previous one. What is okay? I think maybe we are a bit difficult in language communication, so I try to make it as clear as possible and slower in speech. And I believe so many of you are still wondering what is PLLA and what does it distinguish with hyaluronic acid, which is HA. To understand this, first we must know that PLLA is lactic acid. We just conjugate or link so many of lactic acid together to make it a substance. Just like if you have seen the bottle, it's white powder. It's never in a solution, or just like HA in the syringe is liquid. So it's a powder, not a liquid. And this is important because when we try to use this substance or material, the physical character or texture of both will make different application. Okay? And first, what's special about polylactic acid? As you can see in this PPT, this is the first one ingredient that the FDA of US approved in 2001 for tissue filler. But actually, this is different from most of the filler. What is filler? As you may know, the most famous filler is HA, but we have collagen for injection, and the other substance, calcium, is hydroxyfied calcium, is also a filler. But actually, these three kind of filler makes no difference whether it's hyaluronic acid or collagen, because how it functions is to occupy a space in your tissue, to puff your tissue, whether with HA or collagen. It makes no difference because it didn't interact with your tissue. And that's the point that the PLLA is different from tissue filler, because PLLA will react with your tissue. So the polylactic acid after injection, it will degrade into lactic acid, and the lactic acid, which will stimulate your fibroblasts. It increase their activity, also increase their number. And as you all know, the fibroblasts, the main task of fibroblasts is to secrete or make collagen fiber. And there is one important concept. Maybe 4 years ago, the Massachusetts Hospital, General Hospital in the US, they find a very important phenomenon. When they try to have a heart implant, they fail to develop a heart from a stem cell. You know, for 20 years, since we know the function of stem cell, we imagined 20 years ago that we will have a limited supply of organ, including liver, kidney, heart to transplant. But after these 20 years, we have done nothing. We have done nothing. But 4 years ago, the Massachusetts General Hospital made an astonishing work. They just take a heart from the donor, a person who died. Then they mail the cellular component of the heart by some alkaline solution and leave a heart just like a ghost heart. It's a semi-transparent heart, and the structure remaining is collagen fiber. And after they just put the stem cell that in the moderate development stem cell of the recipient's heart cell solution into this ghost heart. Then the ghost heart has developed to a non-allergic heart for the recipient. So after that, we understand the collagen structure is the most important blueprint for our soft tissue. That's why if you can reconstruct collagen fiber, you can reconstruct soft tissue. And this is a very important mechanism for PLLA. We just mentioned that PLLA can degrade into lactic acid, and the lactic acid is the modulator or stimulator of fibroblasts, and the fibroblasts can reconstruct collagen fiber. That is, if you can control or increase your lactic acid amount, then you can successfully reconstruct your soft tissue. That's why I like to call the PLLA just like an exercise club member card. When you inject the PLLA in your soft tissue, it's just like it teach you exercise. And we all have this experience that if you go to the gym or you climb mountain or you play tennis very vigorously, then when you came home, you feel soreness in your muscle. But after 2 or 3 days, you feel better, you feel stronger. And why is that? I think it's the phenomenon caused by lactic acid. So the lactic acid is so important. When we pick 2 patients, one has a continuous exercise habit for maybe 5 years, 10 years. And if we pick another patient that didn't do any exercise, and we just have an experience test to identify which one is better. I think anyone can identify the subject that with exercise looks better. We just in an experienced eye, they just don't know why this one looks better. Actually, is the reason of continuous lactic acid stimulation in your soft tissue. So if we inject PLLA now, just like you had keep exercise, but just locally. So if you keep exercise 5 years, 10 years, after 5 years or 10 years, it looks young. And what is young? I think you can separate for many concepts. Your skin is, your dermis is thicker, and the skin is shorter, and your pore is small, so the skin looks shiny, and you have less pigmentation. So in many ways, you are better, and the whole concept is younger. That is why if you have continuous exercise, or if you have PLLA injection, it looks alike. It's just an artificial gymnasium in your face or your body, because you can inject PLLA in any area, including face, body. I think the limitation, just no limitation. We know that we can inject in the whole trunk, including breast, buttock, or anywhere you like. Okay. And so we know that PLLA, just we mentioned just now, it can react with your soft tissue. It's just not like you inject hyaluronic acid. The hyaluronic acid, when you inject into the tissue, it just stay there and occupy a space. And with time, it will degrade, shrink, and nothing. Your tissue is the same. And worse yet, your tissue, if you inflate your tissue again and again, it becomes looser with time. So maybe you had the experience that after you inject the face, the so-called tightening of face, no matter how many points you inject, it just inflate your face to look tighter. But after the HA is absorbed, you look more slate. You look worse than previous. It's very different from you inject PLLA, because after you inject PLLA, your skin is actually tighter or shrinking. It's different. Okay. Let's see. Let's pick the picture. I think you can have this PPT for the language, so you can see the language explanation later. We just okay, stop here. Stop this, the previous one picture, because this is a very important concept. Yes, this one. Let us look at this picture. This is the collagen fiber of our dermis. After taking away the other cell, including fat, vessel, nerve, or anything else, it just leave a network of collagen fiber. And how large is this picture? You can see in the right lower corner. This is 1 micron. So this picture is less than 20 micron. And how large is 1 micron? Have you ever seen the needle we inject? If you use a 30 gauge needle, the inner diameter of 30 gauge needle is 100 micron. So this picture looks very large wave, but actually it's small, it's tiny. And how tiny is this? If you pick one of your hair and you cut through the cross section of hair, it's larger than this picture. So if your cross section of hair is larger than this, then the wave is the pore of the wave is actually very tiny. So when you inject HA into your tissue, it will not dissipate through this hole. So the HA stay there. That's why you can use HA to elevate your nose, to lengthen your chin, and it will not mingle with your tissue. Okay, and this is very important concept. And what if you inject PLLA into your tissue? It will dissipate through this hole, so it will become a very even surface. That's different. That's different physically for these two solutions. The PLLA solution is just like water, and the HA is just like gel. The gel cannot penetrate through this hole, and the water base can penetrate through this. So when we inject both PLLA and HA, we use a different technique. Okay, and next, let's see what is important here. Okay, next, and okay, next. Okay, another concept is about this. We used to use HA. Everybody is used to use HA for injection. I think it's the mainstream injection material. But when your customer came to you, they just want to look better. And what is better? I think we can separate into two concepts. When you use HA, mostly you change your facial contour. It is specialized in change your contour. For example, when you inject in your nose, your lip, your cheek, or maybe some likes to inject in eyebrow, especially in Eastern customer. They just want to look so Western. So no, previous one. No. Okay. And so when you use HA, yes, you change your facial contour or your facial outline. It's very good for HA, but there is another area that we just ignore. Is what about your skin texture or your soft tissue texture? I think it's very important part that contribute to beauty. because when you change your contour, you have to be very careful. Next one, next PPT. Next PPT, please. Yes. For example, every time I give a speech, if it's in Eastern country, then I ask the audience which kind of face or cheek you like. I think most of the audience, they will say right side, because the Eastern culture say you have to be maybe not so slim face. They like that. But as you can see in this left side picture, the cheekbone is higher. Sometimes they make some shadow in cosmetic in the lower face to make the cheekbone higher. So it's different for what is beauty, east from west. So when you change contour, you must be very careful, because you have to know the tendency of this patient. If she like right side picture or left side picture, if you change left side picture to right side picture, maybe patient didn't like it. It's not about your technique. It's about your cultural concept. But when I ask any audience, the left side skin texture and the right side skin texture, which one do you like? I never met anyone pick the left side. Okay, because everyone just like to look young, have a fair skin, have a tighter skin, have a shiny skin. So what's the difference of PLLA with other skin, with other feeder? PLLA can change the texture. This is a very important part that we ignore in the past. Okay, this is the first material that really changed your skin texture. Okay, next slide. Okay, this picture shows the different reaction of feeder and PLLA. I like to call PLLA that it is a skin rejuvenator. And in the left side of this picture is PLLA, and the right side is HA. As you can see, the right side, when you inject HA in the tissue, as time goes by, it disappears, and your tissue remains the same. In the left side, when you inject just a tiny bit of PLLA, it will dissipate into your tissue in a larger area than you originally inject. Then it will start to stimulate to make change in your tissue. As you know, it can increase the collagen fiber, and subsequently all the other components of your skin, such as fat cell and your own hyaluronic acid, will also increase, and blood vessel and nerve tissue, it also increase. So it's the whole renew of your tissue. So it's different from when you inject an HA. Okay, next PPT. Okay, we can look at the next picture. The next one. Okay, you can see this. Here we can see the red bold character, liquid processes. This is a nomenclature that I like to call derma filler. When you inject HA into tissue, it's nothing different with put in processes in your tissue. It's just that the processes is liquid. And what is special when you call it processes, you have to remember when we put any processes into your tissue, there is no blood supply there. And what's bad with no blood supply? I think infection. Infection is a very serious problem, and it's very common when we put a process there. So if you put PLLA into tissue, you have no blood supply problem. In the contrary, you increase your blood supply. That is why when you search the literature in the world, you cannot find even one literature that describe they have problem of infection when injecting PLLA. Okay, next one. Okay, next one. I think we have limited time, so maybe you can see this, see the content of the PPT later. So okay, we just pick some important concept to discuss with you, and we go to the Q&A. I think most of the time we leave it to Q&A because everyone has different background, different experience. It's better that I answer directly to your question. Okay, next one. We just roll this PPT, and if I see anything important, then I stop rolling this PPT. Okay. Yes, this one. We can see Sculptra, the first PLLA product in the world. It was made its debut in maybe 2001, so it's almost 20 years from now. And this morning I had injected one patient who insists. This is the only patient who insists to inject Sculptra, and it's very difficult because I know that Sculptra had changed their formula, but it's still difficult to inject with a small needle. We can see the particle size. The second line of this table is the size. Sculptra is 50 to 70 micron, and we know that there's another brand called IC-Feel. It's from Korea. It's smaller. It's about 50. It's 40 to 50 micron actually. And you can see TrueSelf. TrueSelf pick the range, maybe 3 to 15. Some of the particle is larger, is 15, so it's 3 to 15 micron. And what's the difference with these three? Obviously, you cannot inject with a 30 gauge, maybe even 27 gauge needle with Sculptra. It's very difficult. This morning, I inject with almost 23 gauge, so the Sculptra won't obstruct the needle. And as for TrueSelf, you can use even 34 gauge needle to inject the patient. Okay, and the dilution time is also different. When I use TrueSelf, I often dilute the powder maybe in 5 minutes, 3 minutes. And when you use Sculptra, you better dilute it the previous day. That is to say, 24 hours before. And yes, there is another character that TrueSelf different with Sculptra or IC-Feel. That is the painful sensation when you inject, because TrueSelf use the unlinked HA for their adjuvant, so it's more it's less painful. And the Sculptra and Aciphyr, they use hydroxycellulose for their adjuvant component, so it's more painful when you inject. And the last line, when you talk about side effect, the larger the particle is, the easier you will form nodularity or tubercle inside your tissue, because it's very difficult for a larger particle to separate evenly in your tissue. Okay, next slide, next PPT. Okay, okay. Some of the doctors, they often ask me what's the difference for the epithelium growth factor vs PLLA. I think the most important point is one is controlled growth, and the EGF is uncontrolled growth. This is very important. And when we develop any kind of treatment or medication, I often like to see whether we can control it. This is the first task we must overcome. If we cannot control it, no matter how effective they are, it's a failed medication. And when you use EGF, you can see from their work, it's epidermal growth factor. So it's not for inject into your tissue. You cannot inject it into dermis or subcutaneous tissue. It will be act like maybe neoplasm or cancer, because this is not the tissue where it should go. And so the safety material to use is PLLA and not EGF. So you must distinguish these two. People always say PLLA will stimulate the growth and the EGF will stimulate your tissue growth. And what's the difference? The most important point is one is controlled growth, the other is uncontrollable. Okay, next please. Next PPT, yes. Okay, and when you compare these two materials, one is PMMA particle and the other is PLLA particle. We know that PMMA cannot go away. They will stay there forever. And the PLLA will degrade with time, maybe 1 year, 2 years, or you can manipulate the molecular structure to become 10 years. But at least you can change the degradation time. But if you inject PMMA, this kind of microsphere, it will stay inside your tissue forever. And so it's a foreign body for your tissue. So it can stimulate, it also can stimulate collagen fiber. But I think it will stimulate your collagen fiber forever. So it's too much, and it's an uneven surface, because when we inject PMMA, you have to have carrier, and the carrier such as hydroxycellulose, it will be absorbed. But the PMMA microsphere will stay in your tissue forever. So for the long term, you can see many nodulation when you inject PLLA into your tissue. But many doctors say TrueSelf or the other product of PLLA will function as foreign body. So I think it's different from PLLA. We can see when you inject the true foreign body, such as PLLA, and you can observe for 2 years, 3 years, and you will look at an uneven surface. So the mechanism of PLLA react with your tissue is different. The PLLA is not function. It's not function because it's a foreign body. It will function as it degrade into lactic acid. So it's a biological interaction, not a mechanical interaction, just like foreign body, such as PLLA. So I think the mechanism for why PLLA is effective to stimulate collagen is different from PLLA. This is very important, and I think the mainstream literature get this wrong. So if you want to get a larger foreign body reaction, you must make the powder more coarse, just like Sculptra. So because we don't want foreign body reaction, so we make the powder the sphere tinier. Okay, next PPT. Okay, there is some very important rule for safe PLLA injection. The first target is to have a safe dosage limitation. We all know that PLLA can stimulate collagen fiber, and is more collagen fiber is better. I think it's wrong. We have an example. If you look at a patient with surgical scar, and when you take the scar for a biopsy examination under microscope, you can see the scar is 100% collagen fiber. So collagen fiber is not is the salt with double side. If you lose too much collagen fiber, you look older. If you have too much collagen fiber, it's just like a scar. When we see it from outside of the skin, it's a scar. But if this scar, we hide it under the skin or your soft tissue, we call it nodule. So we know the most common complication of PLLA injection is nodulation, or you have nodule, which can be failed from outside. I think the problem is dosage control. When you inject too much PLLA locally, you get too much collagen fiber, so you can feel the lump or feel the nodule inside. So the first target of a safe injection is dosage control. Okay, and how can we achieve this dosage control? I think it's related to how you inject. I know most of the doctors is used to use brown needle and the tunnel injection. And I have another kind of injection that dot matrix, we use a sharp needle, small needle for point injection. And you can use both techniques, but I think the advantage of dot injection or point injection is you can control the dosage better. Okay, let's find some picture to explain this one. Okay, this is the picture. Explain why when you use tunnel injection, what what a disadvantage you have. As the upper picture shows, when you withdraw the brown needle out, even you push your dosage or your solution very evenly, in just a second, if the other side of the skin is tighter or the pressure is larger, we can see the solution will shift to the other side. So you cannot control, even if you have a very steady hand to push the solution evenly. Maybe in 3 seconds, the solution gets to where you want or where the tissue's pressure wanted to go. Next one. I think the most of this tunnel injection experience came from when we inject HA. If you inject hyaluronic acid and you have a steady hand, you can control a very even dosage under your skin or in the soft tissue. But when you inject PLLA, the solution is more like water, so it can flow freely in your tissue very easily. Next PPT. Next slide, please. And there is another disadvantage. And when we use tunnel injection, mostly we make the tunnel in a fan shape, and because it had a common opening, so every time you withdraw the needle and we open another tunnel, I think the opening, the soft tissue of the opening will be looser. So the pressure here is smaller. And another phenomenon is, especially when we inject in the temporal area, usually this opening is lower and the fan shape is upward. So when you stand up or your patient stand up, all the regimen comes down. So if you look at or you make a analysis for where the nodulation is easily formed, it's usually in the lower side. Okay, next slide. Okay, and what advantage does this matrix injection have? When you try to make some depressed area grow to a flat area, or a flat area to looks like a convex, such as a forehead, you can use matrix injection to make the different dosage. You know, when you repeat it in a different dosage, there is a different growth. So you can adjust, just like this picture. You can adjust the contour very easily. And if you use tunnel injection, the tissue will grow, but it looks like the same shape. Okay, next PPT. Next one. Okay, I think if we have next meeting, we can have many concepts to discuss with you, and I will leave the time to you for your question. Okay, Zuka. Oh, okay.
Oh, I'm here because as we recording, we switch off the sound. Thank you very much for your presentation. For me, directly, after all, I understand why we call it polylactic acid, because any when you produced in products any how to say concerning polylactic acid, it just like when we do exercises, and we get polylactic acid in our
Yes.
skin.
Yes.
So it's
So-
after all, I understand it. Thank you very much for your explanation. Yeah.
Yes.
So
I think it's a more sustainable way to make you look better.
yeah, exercise
when
your
we
skin.
Yes, you can repeat it for your lifetime without any complication, because when you exercise or you take a healthy food and good sleep, you look better, and you can do it for your lifetime. It's no problem. It's just like give you exercise.
Right. Okay. So as I understand, we have two solutions. With hyaluronic acids, we can make volume. With polylactic acids, the only way to improve skin
Texture.
texture. Yeah. So it's understandable. Okay. So the question is, if we need to prepare skin for the injection, to make some vitamins or make some peptides or something like this, what do you think about this?
It's no problem. When you inject PLLA, you can, in the same day, you can inject any other material, vitamin or anything. And if you mix PLLA with other products, PLLA will be no problem. It's because it's very resilient. PLLA is very resilient. But if you mix some product, especially it contains amino acid, it's very sensitive. And the PLLA is acidic, mild acidic. The pH of PLLA is, I think it's in 3.5, pH 3.5. So it's acidic. When amino acid, you put it in acidic environment, some of the amino acid will lose their activity. So PLLA, no problem, but other product you have to consider. If you put PLLA and vitamin C, no problem, because vitamins, the pH of vitamin C is 1, and PLLA is 3.5. And it's very resilient. Whether you put it into acidic or neutral or somewhat alkaline environment, the PLLA has no problem. But the other product maybe have some problem. So if you mix them, you have to consider the acidity or the environment of the solution. And if a patient, if you want to perform image and you also want to inject PLLA, no problem for the same day. It's just that if you do these two items in one day, the skin will be drier, and the patients, your customers' money will be waste a portion of, because it's they have overlapping in the effect. They all tighten the skin, and if you have a procedure tighten skin 100%, and the other procedure tighten skin 100%. If you do this procedure in one day, it will not be 200%. Maybe it's 120%. So it's a waste of money, but it will not cause any complication except drier skin, because each of these procedure will cause a little bit drier of your skin for maybe 3 to 7 days. And if you do any one of the procedure, it's no problem. But you do two procedures at the same time, your patient or your customer will feel dryness of skin for several days. That's the only side effect, and some portion of the money will be wasted.
Okay, I understand. So it's waste of money. So it's as I understand, polylactic acid will produce collagen without any help with vitamins and other products. It's
Yes, yes.
understandable now. Okay, so guys, if you have some questions, you can ask Dr. Cheng. So I also okay, what is target patients for polyoxide acids? Let's say age or some indication. How
Yeah.
you choose a custom? How you choose patients for polyoxide acid injection?
My youngest patient is 15, 16 years old. But it's not for cosmetic. You know, when you inject PLLA to the skin defect, you know, scar, the acne or the smallpox scar, depression scar, is very effective. So
we can use it. We can use it, for example, for patients. Okay, in this case, what is the stria? Кто-нибудь помогите мне, как на английском будет stria? Забыла. So we can use it for acne.
Yes, just like a puncture hole in skin.
Okay.
In
the body, when we have
Skin straight burst.
Yeah.
Oh,
Mixing of language.
I think the stretch of this is you can have a red stretch mark and the white stretch mark. When
yes, for stretch mark, yeah.
Yeah, the birthmark is still red, it's better. When the stretch mark is whitish, I don't think it's effective because the problem is elastic fiber, not collagen fiber. And once the elastic fiber is broken, we don't have anything to repair so far. So it's, I think the volume will increase, but the whitish color remains the same when you inject the stretch mark. But many patients feel it's okay if my skin, the texture will become better. He will satisfy. Yeah, but the whitish line of the birth stretch mark remain the same, but the skin texture is the skin and the soft tissue is thicker. Yeah.
Okay, the next question. How many procedures in your protocol? I found that we need only 2 procedures. But for example, if some customers, some patients wanted, for example, in the neck, they would like, if they see the first result, they are very happy, you know, they're impressed. And they asking for the new procedures. And when we can stop and not to promise, you know, not to promise that it will be like she has her neck in 25, let's say.
You mean
yeah, I mean that they would like to go to 25 when she's 50.
I think for me, it's better to explain and I don't like to have too much higher expectation of my patient because a successful injection is not only a good technique. If any doctor can produce the effect in the world, and you promise your patient that you can get what you wish, then it's a failure.
They are not promised. So they would like they will promise it, you know.
I had some. I use PLLA for many strange target. You know, once I thought it was impossible to inject your nose. Yeah, but I actually do this kind of procedure later. when we inject very tiny volume here and repeat it maybe every 2 or 3 weeks, and after maybe 6 months, 7 months, you can see his nose become higher. And once I had a patient, she asked to correct the string of her nose, the R-like. She asked to inject this angle for the angle to the patient says to my surprise, it had a good effect, but I explained it to my patient that I don't think it works. But the patient said, if only there is no bad complication, if even it doesn't work, she will pay. It's okay. You just inject, and after we inject 2 times, it's very satisfactory. No, and so the use of PLLA, the indication of PLLA is still expanding, and it contains so many areas. I used it to treat some disease. We don't know what's the cause of disease. A patient that he had one side of face just like a skin and attached on the scalp, all the soft tissue is gone. And they had fat transplant 2 times and all failure. They transferred this patient to me, asked me to do another fat transplant, chest implant. But I just explained to the patient, I don't think the fat transfer will work. And I tried to use PLLA, and the effect surprised both me and my patient. Yeah.
Super.
So
and
there is so many.
You use what kind of what concentration you use in this case?
Oh,
when you have lipodystrophy?
It's the same. If you use TrueSelf and the larger box, the 401, yeah, I use 8 cc of normal saline or distilled water plus 2 cc of xylocaine. And I use the same concentration in every site of injection, face, breast, buttock, anywhere. It's the same dilution proportion or concentration. I just change the volume injected because all I want is how much PLLA I put into this point. So if you put too much water, I have to inject that much volume. So I just use the same concentration everywhere, every pocket.
Okay.
And yeah, there is one very important point because we inject PLLA to soft tissue, and most of the soft tissue, you know, we have dermis and the subcutaneous tissue, and these 2 layers have very different dosage, have very different dosage. No, the dermis, they can tolerate only very small amount, and when you inject a small amount, it just displays in a very small distance. And if you inject, your target is subcutaneous tissue, the dosage tolerance is very large, at least 5 times, 10 times. So when I inject, just like in the face, inject the cheek into subcutaneous tissue, I usually inject 0.2 or 0.3 cc, 1 point. And when I inject in the lower lining, it's the minimum amount is 0.03 cc. So it's 10 times difference here and here. And when you inject in the same cheek, in the dermis, and subcutaneous tissue, it's the same 0.03 cc and 0.3 cc. It's also 10 times. It's the same size, but when you inject in the dermis, it's 0.03 cc. And when you inject in the subcutaneous tissue, it's 0.3 cc. It's 10 times dosage difference. It's because when you inject the dermis, the PLLA cannot spread very far. It's just limited in a very tiny space. So you cannot inject too large volume there. So you have to, if you want to inject in the dermis, you have to have a very close injecting point. Usually I use 0.5 centimeter distance. It's just 0.5 centimeter, one injection in the dermis, and the dosage is very small. And when I want to increase the volume, I inject into subcutaneous tissue. I inject maybe 0.2 cc each point, and the point distance will be 1 centimeter to maybe 1.5 centimeter. It's because the dissipation distance is different. It's just like you throw underwater bomb to attack submarine. After explosion, it's only a tiny circle. When you drop a big bomb, it explodes a very big circle. So the different tissue with different dosage. So you have to know your target difference, whether you want to inject into dermis or subcutaneous tissue. So so many doctors, when they learn the matrix injection, but they penetrate the needle only in the dermis. So they think their volume, they don't have overdosage, but it's for subcutaneous tissue. Since their needle didn't penetrate through the dermis, they are in the dermis. So it's really large volume, really large dosage. So you have to understand where is your needle, in the dermis or in the subcutaneous tissue. It's very important. So when you practice the matrix injection, the first thing you must learn is to feel whether the needle is still in the dermis or out of the penetrate the dermis, under the dermis. Yeah.
There is another, another opinion that for polylactic acid, we need to inject very deep, almost to the bone, let's say. What do you
No,
think
I
about
think
this?
Point is, when you inject too deep, usually you will inject into muscle, especially in the temporal area.
Okay.
The muscle is very big. And we know that when you inject into muscle, PLLA doesn't function because there is no fibroblast, or you cannot produce fibroblast in the muscle layer. The PLLA is to stimulate fibroblast. So you must inject where they have fibroblast, or you can produce fibroblast. That is, dermis is the best target, then the subdermis, because the collagen component is larger in dermis. Then the second one is subcutaneous tissue. And there is almost no collagen fiber in muscle layer. Yeah. So when you inject the PLLA into muscle layer, it's empty bullet. You just waste the solution. And there is the second disadvantage when you inject too deep, because we have a tissue layer, which is the solution will spread very easily. So when you inject too deep, the solution is easily dissipate, is very far from your target. So you cannot control your dose. Okay. Okay, so
Okay,
I don't
but
inject.
for example, when we, for example, the first question, for injection for the breast, which kind of result we can get in this case? For injection in
Fat
yeah.
layer and the memory gland layer. This we have two layers, and the muscle layer. As we just explained, we don't inject in when we inject for breast augmentation. We don't inject it because if you inject to muscle layer, it's not only useless but also very dangerous because under the muscle layer is the lung. So we don't inject very deep. And if we inject the mammary gland, I don't think it helps because it's very compact tissue. So, I think it won't cause, it will not cause any complication or any nodulation, but the breast gland is very tight. So when you inject PLLA, I don't think it will produce many tissue. So actually, we inject the subcutaneous tissue. So when we inject into breast, we don't. We hope our patient will not have a very high expectation for volume. I think I choose the patient with cup size A, only cup size A. If you inject to a cup size B patients, maybe her breast volume is 200 or 250. And I think the maximum volume increase with PLLA injection is only 50, maybe not over 70 cc. So in a 250 cc volume breast, you increase 50 cc. It's not very effective. But in a cup size A patient, maybe he has only 100 or 150 cc volume. When you have 100 cc volume, you increase 50 cc, I think it's very prominent. And the second point is we don't inject the whole breast. The most important area we inject is the medium and the upper part. We don't inject the lower and the lateral part because for a small breast lady, if you can increase very tiny volume of this group, she will be very satisfied. If only you can increase volume in the upper and the inner part of the breast. So we pick our patient. The best patient is no matter what, she refuse surgery. Then inject the PLLA is the only choice because even you do auto fat transplant is a kind of surgery. And when you inject PLLA, you can inject anytime. You don't have to receive a surgical procedure. You can inject anytime you want. So it's the non-surgical procedure for breast augmentation. And the other kind of patient is postpartum loosening of breast. And we inject both the dermis and the subcutaneous area. So the breast can contract a little bit. This is two best patients. One is small breast. The other is postpartum slacks for the breast.
Okay. Another question that we have had very often. The injection with polylactic is not safe. So many complications, such as heal scars, and we can treat it and correct it. There is no any antidote to manage it. What is your suggestion?
First, I think it's the safest material for injection. No.
Yeah, we had such kind of problem. Yeah. Once we.
Yeah. It's almost 20 years.
Yeah.
And I inject at least 30,000 cases. And all my patients, they don't message when they go home. And not anyone has a nodule because it's unrelated whether you message or not when you go home. It's it depends on how you give the dose. If you cannot control the dose, you get a nodulation or scar. So it's not a problem of PLLA. It's the problem of how you inject. So you just have to control the dosage distribution. No problem at all. And when we inject PLLA, we don't have to worry about infection. I often inject over 100 sites, 100 points for each injection. And after injection, immediately after the injection, patient can wash face, can make up or exercise, anything they want. I often joking with patient because patient will be worried because they often told that they cannot wash face for 7 days or they cannot make up for 2 days, 3 days. And I often joking with them, you can pick any dirt outside. You can put it in your face. And actually 2 patients do that. And they are surprised. We can use any dirt thing on the face and it's okay. So it's a trouble-free injection. And the other important character is the patient will stick with you as long as he can afford that. And I think we had very few material to use like this. When you inject HA, you have to be very careful. No matter because HA, as I mentioned just before, it's a liquid processes. And when we had make an area that has no blood supply, actually the chance of infection will be increased. So I think PLLA is trouble-free or worry-free material for injection. Yeah, this is the first point I want to share with you. And I forget your question.
If, for example, we got this problem, we got some scars.
Yes.
How we manage it?
Yes.
No matter, for example, in hyaluronic acids, we can use hyaluronidase. What we can use in this case? If, for example, it happened. I know that another question, sorry for interrupted. Another question. If it depends, or also it depends on the size of polylactic acids.
I think there's one very important idea that I want to share with you, that because I helped so many doctors to deal with this kind of problem, and the most situation I encounter is some doctor told me that their patient has no duration, 2 weeks, 3 weeks, or 3 days after injection. They say they had no duration, and how do we do with this situation? The first is the no duration. The true no duration is scar, because PLLA produce collagen fiber. And too much collagen fiber is scar. But if a patient receives a surgery, the first scar appear maybe 4 months later. So how do one patient receive PLLA 3 days and he had a scar inside? So it's no chance. But how we feel one nodulation inside is chemical and the immune reaction. This is acidic material. So when you inject too much of that, you attract so many of the white blood cell or the immune cell. So you feel like the nodulation inside. So the best way to treat this nodulation before 4 months is to do nothing. You don't massage, you don't keep packing. Some patients or doctors always want patient to massage the nodulation to go away. I think it makes it worse, especially before 4 months, because the first scar appearance will be later than 4 to 5 months. So if you inject in a very short time and appear to have a nodulation, don't do anything. And if you can patiently wait for 4 months, I think 90% of the nodulation will go away by itself. You don't have to treat it. The most difficult problem is how to communicate with your patient that we don't touch it. And if whatever happens, if after 4 months you still have a nodulation, then it's a true scar, true nodulation. Then we of course we can use triamcinolone solution to inject, just like
Can you write to us, please, because we had not with your products, but with another product. We had such kind of problem, and if, for example, this problem is coming, how we can manage it?
Yeah, we inject the steroid into the nodulation, but be careful. Yeah, you have to be sure you inject right into the nodulation. So maybe I dilute. I don't over injection. No, the most common complication when we go to help deal with this kind of situation is depressed treatment site, because they inject too much of steroid. So I recommend that you dilute the steroid you want to injection, maybe 5 times, dilute 5 times volume, and inject only a tiny volume each time, and be sure to inject right into the nodule. Don't inject outside of the nodule, because if you inject into normal tissue, the nodulation will be more prominent. It looks worse. Then you don't treat it. Okay. So be sure to inject right into the nodulation. Sometimes the nodulation is very hard, and it's very difficult, especially when the nodulation is in the lower eyelid. The tissue is too soft, and the nodulation is so small, so hard, so it's very difficult to inject. No, it is the most trickiest situation. If you is in the cheek or in the frontal area, it's easier to inject. Okay. And remember to inject small amount, because if the dosage is not enough, we can repeat injection, and the interval of every steroid dosage be at least separate. Don't inject every 2 weeks or 3 weeks, because every time you inject steroid, the effect will appear maybe only after 3 months. The dosage will go away. So if you inject too frequently, you will accumulate the effect. Maybe every time you inject just a tiny amount, tiny amount every 2 weeks. Then you can see, oh, 2 months later is overdoses. Yeah.
Okay. And so some other questions. Can you show please your video with techniques, how you manage in tempo zone, for example?
Oh, yes. Maybe if you have a sunken temporal area, most of the people have a most depressed area just like this. Yeah. So we have marked this the 1 centimeter apart, and you find the axis. You find the axis, just point, make a mark. Then you extend upward and the lower the same distance, 1 centimeter, and mark the point. Maybe we have the video. We can show.
Yes, please.
How
It will
the
be very interesting to see. And one more question: if we can put if we can put the products on the brow.
Yeah. No. It's if you want to elevate the brow, it's just like
on the brow.
nose. Oh, you mean brow or frontal area?
Yeah, below. Sorry, not under. Below. Yeah. Yeah.
Below brow is upper eyelid.
Yeah.
Yes. Many people have sunken upper eyelid. So we can inject maybe 0.5 centimeter apart every point, and only 0.02 cc volume. Yeah, subcutaneously. Yeah.
Okay.
Yeah. Okay. We have maybe we have video for.
Okay, thank you.
For this.
Show us, please. It's very interesting. Show us, please.
Okay. It's very easy to inject here. Okay, Aju, can you please play the video? And you make the mark, friend, and when you inject, you just know you penetrate dermis, and that's enough. You don't care for just penetrate or deeper. It makes no difference because the solution will dissipate. No, not only for the horizontal area, but also for the vertical. It's a sphere. When you inject a volume, it will expand like a ball. So if only you can penetrate through the dermis, you can easily put your dosage anywhere. Deeper or shallower, it's okay. But remember to penetrate the dermis. Don't put the dosage into the dermis because it will be too large dose.
We had another question from Indonesia. So you have two concentration, 400 and 120.
Yeah.
What is the difference between these two? And also, I would like to ask some question. You put in your ingredients some hyaluronic acids. Why? For what? Yeah. Can you explain please the formula a little bit?
Yeah.
Because before we have had experience to working with polylactic acids, but without hyaluronic acids. What is your suggestion?
I think TrueSelf is the only product of PLLA with HA, but we had two kinds of HA. One is cross-link, one is non-cross-link, and the HA put into PLLA, put into TrueSelf is non-cross-link, and it's a special kind of HA that very expensive, maybe 10 times more expensive than cross-link PLLA.
So this hyaluronic acid from Japan, as I understand, right?
No, it's from China. You know, the biggest manufacturer for HA is in China for the world. They have market share of 64%.
Because those opinions that from Japan, no, it's not true.
No, Japan don't have HA product. The biggest one.
So it's just
you know,
marketing.
Yeah, you know the wrestling, or they use the HA from China. It's a company called Brumage. They are the largest supplier of HA in the world, and they have one patented HA which can inject into eyeball. It's the same HA would put into TrueSelf. It's their patent, and we worry about obstruction of the vessel when we inject the cross-link HA. But actually, there is one HA which you can safely inject to eyeball. It is from this company, the Brumage, which is CE patented and the FDA patented, and we use it for the adjuvant. Adjuvant in the TrueSelf. It's not main ingredient, but it helps to dissipate the tiny PLLA particle. So when you check it even, it descends very slowly. Is because this HA, and it will be more comfortable when we inject. You know,
more pain. Yeah.
It's more painless, and it's the same. All the HA inside our body is uncross-linked.
Okay.
And so we use uncross-linked HA to mix. We mix this PLLA particle with your tissue. It's more easily dissipate. It's a more even distribution of the particle. Yeah.
And so the 400 and 120 is the same products,
yes.
or it's
Yes.
it's two different formulas, let's say.
Yes, two different formula, but the same PLLA particle, and with different proportion of the HA.
Okay.
The 120 is with more HA for each cc, so it will be stickier, a little bit stickier. And how we use that? When you inject very tiny volume for a small area, for half face or for neck, you don't have to use totally 12 cc or 10 cc. You only use 4 cc or 5 cc. That's 120, and the 400 is for whole face, and so it's the volume different after you dilute.
The same products, the only volume is different. Understand?
Yeah, and a very tiny difference in the HA component. Yeah.
Okay.
When you inject the dermis, we want it to be had a slightly volume effect. So we put a little bit more HA inside 120. When you inject the superficial area, they have a better volume expansion effect. And when you inject it inside, if you use 120 and the 400, it makes no difference.
Okay. And Dr. Cheng, can I ask you to show the photos that you showed me before with your patient, very young, about 8, something like this, 8 age. Your patient, you show me this photo.
You mean my oldest patient?
Can you...
My oldest patient is 87 years old, and I have a photo of her this time when we go back to Taiwan. Maybe in the PPT we have put into our PPT. Could you find the picture of the oldest lady of my patient. And also I try to find the picture. Yes, this one. This is my oldest patient. She's 87 years old. Is maybe 67 years old. And if we can enlarge this video, you can see the only place that I forget to, or I didn't inject is her cheek area. So the cheek area is her real age.
Your own, yeah.
And, yeah, the chin, yeah. And both forehead and the cheek area is has injected this PLLA for it's 39 times every half year, so it's 20 years. I had count in her chart is the 39 times she received injection. Yeah.
Yeah.
So this is the oldest patient, and the youngest patient is around 15, 16 years old for the acne scar. Yeah. And for cosmetic patient, my youngest patient is 26 years old. The younger you start to inject is the better, you know. When we inject the same material to 30 years old and 50 years old, the younger patient improve much more than the older patient. Yeah.
And can
So,
you, yeah, continue, please.
Okay.
Can-
So we usually tell our customer, if you want to anti-aging, the earlier the better. Yeah. If you are 50, 60 years old, the most we can do is turn you back to maybe 45 or early 40s. But if you start to inject in the early 30s, then after you are 50 or 60 years old, maybe you look like 37, 36. Yeah. So start it earlier the better.
And what do you think about vagina rejuvenation? How it will be? How it will be? What let's say? What is the best products for vagina rejuvenation? Hyaluronic acid or polylactic acid?
Yes, I will have a speech in May 9, maybe 3 weeks later, about this topic. And and I searched the article or the literature from the world, and I first looked at complications. And because when we compare the risk with the material you use, we know the most dangerous material is fat. You know, because
fat, really?
when we inject,
it's very popular to use fat in for this matter. It's not safe
because when we it's not but it's the chance is small, but all the small chance, the larger is fat, and the second is HA. No, because when we have complication, if you inject face and the vagina, I think vagina is more dangerous because there is so many vessels there, a large size vessel. So you can push so many of the volume, including fat or HA, which will easily obstruct the vessel. And when we inject face, the vessel is very small, so it's not easy to inject into vessel. So the most fatal complication is lung, is when the obstruction occurs in lung. Is usually will cause patient death or very dangerous complication or stroke. And when you inject the face, the most major problem is your retina artery obstruction. So it's different. And when we try to understand why fat is the most dangerous material to injection, is when you compare the particle size. The most dangerous material is the largest particle size, then the collagen fiber. Yeah. So the PLLA is the safest method to inject. I usually have several experience of inject into vessel, maybe 10 times, at least 10 times each year when I inject the face. And because every time I inject, I withdraw the syringe, but sometimes you don't have brush withdrawn when you withdraw the syringe. Even the needle is in the vessel. So when we push, if you inject PLLA, especially the fine particle of PLLA, if you inject scatula and the Trueself, I think the risk is somewhat different, because there is only one case report for PLLA injection into vessel, which cause problem. It's larger size scatula. No? And
Yes,
the small particle.
That's
for
why so
Trueself,
many, so many questions about, because it's needed to be, first of all, it was needed before to manage, but with these new formulas, with new molecules, I suppose that it's much more safe. Sorry for interrupting again.
Okay. Yeah, I actually inject into vessel maybe at least 10 times each year. When I inject Trueself into vessel, you can see a whitish triangular area, but only for maybe not more than 2 seconds. And the whitish, that just like shed area, will be turned pink again. You only have maybe 1.5 seconds to witness what happened when you inject into artery. It turned white for only 1.5 seconds. And so you can see sometimes I inject into vessel, but it never obstruct because the particle is too tiny. The first one is, and the second is, this is water solution. It's not gel. So it will go through the vessel easily. Yeah. So I think it's the most worry-free material we can find. Yeah. So when you inject vagina, where the vessel is so much more than face, is more dangerous, and you pick the right material. When you especially inject in vagina wall. And if you inject in the minor or major labium, I don't think there's any problem. It's just like inject the cheek or anywhere in the body. No dangerous at all.
Okay, thank you. So
yes, there is another point. Another difference when you inject PLLA or HA and fat into vagina or any external genitalia. Because when you inject PLLA, patient always tell you that she become more sensitive. But when you inject
it's very
HA
important
or fat,
point. Right.
yeah,
Very important point.
yeah,
Because they
yeah,
improve
because
the zone, but not feel anything after injection.
yes.
Yeah.
This is very important because we reconstruct every component of your skin, including blood vessel or small nerve ending. So the patient will feel more sensitive after injection of this PLLA. Yes.
It's really very important. So can you show us video how to manage on the temple or maybe
Okay.
orbital zone?
Okay. Did you find the video? If you find it, you can play it now. I think the first thing is planning. When we inject a sunken area, no matter it's temporal area or we have so many people have sunken group in the forehead or cheek. If you use matrix injection, don't let me see. You don't inject every point the same dosage. You can make different doses. You have a higher dose in the most sunken area, so you can adjust the contour of face. Yeah, this is a typical sunken temporal area, and because she has a very high cheek, and I often tell my patients that I will not feel so many material here because we don't have ideal material. Even if you put fat, you cannot make it very thick. 1 cm thick is not realistic. And I just changed the shape. You know, if you have a very prominent cheek patient, their curve just like a very sharp turning. You know, so if you turn the sharp curve into a mild curve, so the highest point and the lowest point, even you don't change the highest point and the lowest point, patient feel she's somewhat poor, you know. Okay. Actually, could you yes, okay. This is when we find the most sunken area, and you make the point or make the plan from eye angle to the hairline. And you can see the first axis, then I make the second axis, then the third. But you can see the axis extend from eye angle to hairline, the first one, and from here we extend lower, and this is upper, the upper second axis and the upper third axis, which has only 2 points, and every point is almost one distance apart, one centimeter distance. Okay, and since she has sunken forehead area next to the eyebrow, we extend the injection above the eyebrow. Yeah, make sure every point has a distance of about 1 centimeter. Yeah. When we start to inject, you only make sure that the needle penetrates through dermis. You don't inject, you don't put the dosage in the dermis. And for the area above the eye line, the eye angle, including upper temple area and the forehead, I adjust the dosage above or below 0.1 cc. So I think it's difficult to make you see clear how much I inject here.
No, it's visible. It's visible. It's
Okay.
visible in the
Okay.
syringe.
Yeah. Okay. Not every point is the same dosage. Usually, we put larger dose in the most sunken axis, and you decrease with a gradient. For example, the most sunken area, you put 0.15 cc, and the second axis you put 0.1 cc, and the third axis you put only 0.5 cc. Then you have the concave area gradually become flat, because in the most sunken area you put larger dose. Then the second area you put not so large. Then the smallest dose is in the edge. So after time, you will grow more in the most sunken area. So you will become smooth curve. I don't put the same dose in every dot. So I can adjust the contour of the face. And if you use tunnel injection, it's more difficult to adjust the contour, because you cannot control exactly how much dose in this tiny area. So it's difficult to adjust the contour of face. We have many video in the app. So although it's not in English, but you can see it first. And if you after your doctor has more experience for injection, you can put their video there in Czech or in Russia or in Norway language.
We will do in future, and we will translate it. But for us, it's more important to see how you manage it, the techniques. Yeah.
Oh, and another important point is every time you inject, you pull the needle, you must squeeze the point immediately. So if you make the sequence of injection here, and the gouge and the pull squeeze. So after injection, although you inject maybe 100 points, it's just like nothing happened. And people cannot tell, oh, you received some kind of injection, because there is no mark.
We had some another question. If we can use the whole wheels in one procedure, whole 12 cc.
Sorry, you mean?
I suppose that question is about if, for example, we will take 400 concentration and we will get the whole solution for 12 cc. If we can use the whole 12 cc in one procedure, the whole this bottle.
Sorry, I don't understand. You say that you use the 400?
It's just question in chat. For example, the bottle, we have two solutions. One is 120 and another is 400. If we will take one bottle for this 400, is it safe to use it in one procedure? The whole
one procedure.
Yeah, in one procedure, the whole bottle.
The whole bottle, yeah.
I will show this one. This one. Because I have it with me. If we can, use the whole this bottle in one procedure.
Yeah. Usually I use at least one bottle for whole face, and the most larger dose I use for one face is two bottles of 400. Yeah, and sometimes you have patients they only want to inject maybe temporal area or infraorbital area, but you have a large 400 bottle. So I suggest that when you add water, you use fine needle, maybe 27 or 30 needle. In which case the rubber plug can contract completely, so it will not some dirty thing contaminate inside. So you can use half bottle and set the half bottle for another patient, you know. Yeah, but
when we dissolve it, sorry again, when we already to make a solution, for how long time we can keep it?
I had tested for the longest period, 6 months. It's okay. It's the
wow,
same
really? So any problem we can solve it and keep it even for 6 months.
Yeah. But just remember, when you put water inside, you use small needle. We don't use large needle because the puncture hole will not contract completely. So use a small needle to add water if you want to leave part of this solution for later use. And the second point is, don't add the lidocaine inside. You withdraw whatever you want and dilute or add lidocaine. Don't put these two components together for long term, because nobody knows if you put lidocaine for long term whether it will interact or not. Nobody make the test. So you just for example, you had 10 cc inside, and you withdraw 5 cc, then add 1 cc of lidocaine. You don't add the lidocaine into the bottle. Okay. Then you can put for a very long time.
Great. And I have seen in this video you manage with problem around back.
Yeah, this is for the fine wrinkle,
backs,
very fine wrinkle, or she have sunken eyelid or anything. We just improve the texture of dermis. So not only you can use around the orbital area, you can use anywhere in the body. So you can use that with maybe hand, the skin of hand, or anywhere. And if you have a very large area for injection, and if you feel trouble, you can put it into the machine, you know, the dermagun machine to inject, which is will faster to inject. Yeah, so it's the kind of thermal injection, and every dose is very tiny. I usually set a target for the 1 cc syringe to push only one tiny scale, which is about 0.001 cc. Yeah, but because sometimes you will push too much, So I don't set the target, might push the dose target at 0.2 or 0.3, because sometimes you will push more. So I push 0.001 cc. I know it's not the most effective or the largest dose, because we usually have a buffer for the maximum effect. I don't use the maximum dosage. I know I can increase some dose without complication, but who knows, maybe this patient will have complication at low dose. So usually I don't push the limit of the dose to the maximum.
For
And,
lacrimal group, it will be very interesting how you manage this area. Can you explain us?
You mean manage this
area, lacrimal.
Okay. You don't have to do any mark, because I don't know whether I inject the tier 12 or the periorbital area, this patient. I don't remember this one. And if, okay, let's see. Oh, it's not intradermal injection. This patient is the most common method we use for the infraorbital area. You can see the distance between every dot is smaller. It's about 0.5 centimeter. You can put the point just like the bowling ball, you know, 4 bottle, 3 bottle, 2 bottle, 1 bottle. When you play bowling ball, it's just like this. And be careful the dosage of the upper row different very much with the lower row. The lowest point usually we put 0.1 cc, and the upper part, the most upper part, the 4 point, we put only 0.003 cc, which is 1/3 or 3 times at the lower point compared to the upper part. Because why the dosage is different, so great, the gradient is so large, is because this is very thick area, and here just below the lower eyelash is you have a very thin soft tissue. So when we decide how you put how much volume or how much dosage you put, you can take it as when we give fertilizers to the dirt. If you have only a small amount of dirt or soil, you can put only tiny amount of fertilizer. If you put too much fertilizer, the flower will die. So you just take how much soft tissue you have as how much soil you have. If you have only a very small amount of soil, you only put tiny amount of fertilizer. Yeah.
So very interesting techniques. So we can use these techniques to make it very natural in let's say smooth, yeah.
Yeah. So you have a full infraorbital area. This is the lowest point. We usually put 0.1 cc inside, and be sure the needle penetrates through the dermis and into the subcutaneous area. Don't put the dose in the dermis. And the second, usually we have 0.75, no, 0.075 cc is 3/4 of the lowest point. And be sure to compress the injecting point right immediately after you pull the needle. Yeah, and the third row, you put 0.05 cc. So it's half of the lowest row. You can see we put only 0.05 cc. And the upper row, we put only maybe 1/3 of a tiny scale. It's about 0.03 cc. And the same, yeah, you can see the volume when you put into the subcutaneous area. The volume will be just like round shape. But if you put it into the dermis, you will not get a volume bump. So be very careful to identify where the dosage go. Don't get into the dermis unless the dosage is for the dermis. It's very tiny amount. And be sure to squeeze the whole area, maybe for 1 minute to decrease the mark of puncture site, the skin puncture site. Not ecchymosis, it's for decrease for the red dot. You can see if you wipe the pencil eye mark, and you can see nothing there. Even you puncture 100 point, and there is no mark left.
It looks nice. Very interesting techniques.
Yeah, and the whole face. Even if you are familiar with this method, you can inject the whole face 100 point, maybe 40 minutes. Start to form. You shake, you throw some air inside the syringe and shake, so the solution become even.
Yes, we even can compare it with, with another polylactic products, because it's very difficult to manage with
Yeah. That's why the Trueself, when you shake it even, it will remain even for at least 10 minutes. And the 10 minutes is enough for 1 syringe injection. And for Sculptra, you can see the first Sculptra the product. When you shake it even, you can see it. You can see precipitation maybe 5 seconds. Yeah. So it's very difficult to manage. So maybe 10 years ago, I only had Sculptra to use. I don't have Trueself. So I just shake it and let the larger particle precipitate. Then I withdraw the more clear upper part. So I estimate maybe 20 to 30% of the PLLA for each bottle of Sculptra. It's it's a waste, but this is the only way I can control the dosage, because the particle they become sediment very fast in the syringe. Then it's very difficult to use.
But even it can be injectable with 30G Needle. You need
Oh.
how you
You
do
can
it.
see
21 needle. What needle?
I use 27 gauge, 27G.
For
Usually
sculpture.
I use Sculptra. No, Sculptra 23 at least. 23. Yeah, it's very large. Yeah.
Wow.
And this is right immediately after injection.
Wow, super. Super.
Okay.
So if anybody
Okay.
have some more question, Irina, maybe you have some question.
I have some comments, dear Zukra.
Yeah, okay.
You know how conservative Norway is. You know how many questions I asked you before to start to use your product. And now I'm proud to collaborate with you. And I respect a lot Dr. Cheng. I love Chinese high-level quality products because we are using Chinese products in Norway with pleasure. And today you inspired us. You give us full information about the safety of product, about the biodegradable, biocompatible, about the technique, about the target fiber process. So I actually don't have any question. I can just say thank you to you both. And let's work. More we
Let's work because as I told you, it's safe, it's great products, but need to understand how to manage with these products. Yeah.
Yes.
So thank you.
Different with HA injection. Yes.
So if anybody have any questions.
Yeah, if anyone has any question, maybe you can write it down and hand it to Zukra, and then Zukra will transfer to me, and I will answer back anytime. Yeah.
So, dear Dr. Cheng, thank you very much. Your explanation, and thank you again. Thank you for your time.
Okay,
and
thank you, everybody.
Keep in touch.
Okay, keep in touch, and have a nice day for you all. Okay, thank you.
Bye bye.
Bye bye.